a very good morning to all the audiences. Although I cannot see them directly, so it's a virtual world, so I can see at least how many are there? 26 participants right now are there, right? You're not audible, boss.
The participants will be increasing with your lecture.
Yeah, I know. If I was the participant, I would have also joined a little late. Especially considering the title of my topic, microbiology.
So Dr. Saab, it's all yours.
So without I think further ado, we should start, I think, if you permit.
Dr. Saab, please go ahead.
Before I start, just let me check whether I am able to share my screen properly with you or not. Please confirm, yeah?
Yeah. Dr. Saab, you are co-host for the program.
Okay. Yes. Is it fine, sir?
Yes. Make it slideshow.
Yeah, I am. Just a sec. Is it fine now? Hello.
साहब अभी स्लाइड शो स्टार्ट नहीं हुआ है.
मैंने स्टार्ट कर दिया बस.
अच्छा हो सकता है हमारा नेट का कुछ इशू हो.
मैंने तो स्टार्ट कर दिया है.
आप स्टार्ट करिए, प्लीज स्टार्ट करिए.
Can you see?
It's visible.
जी स्टार्ट.
Is it visible?
जी.
Yes, sir.
Okay, fine. Thank you. So once again, a very warm good morning from a very cold Shimla to all the participants. And before I start, I just want to request all of you to please put in your comments in the chat box, because this is a virtual thing we are doing, and I want to be more interactive as possible, because I don't want to be a one-way discussion from my side only. So I want everyone to participate and at least give their comments in the chat box. So should we start by typing good morning at least? Someone should.
Good morning, Doctor. I'm here, sir.
I meant in the chat box. So good morning all. So as you can see, the topic for today seems to be quite serious one. The periodontal microbiology, simplified understanding concepts for practical implications. So most of the topic, and most of the people think about the topic, is that it's a very boring and staggering kind of a topic which takes lots of energies, and still you don't understand many concepts. Although time given to me is 1 hour, I'll try to simplify it and at least make you remember few concepts. At least once you go home after this lecture, I want you to understand few things about the characteristics and nature of microbes and the biofilms and the different terminologies we use while dealing with these microbiological concepts in periodontal therapy and management of diseases. So once again, having said that, let's see what we want to achieve. I think slides are not shifting. Yeah, finally. I think there's a problem with the system. So what are the learning objectives we are concentrating upon? After you finish this lecture, I think you should be able to understand what is the importance of microbiology in periodontal diseases. What is a biofilm? What is the nature of biofilm and how it is formed and why it is formed? And how can you utilize this theoretical knowledge into your clinical practice?
Dr. Ajay, sorry to disturb you.
Yeah, sure.
Just a slide show नहीं आ रहा है. I guess it's
slide show नहीं आ रहा है अभी. मैं मेरे एंड पे तो
दोनों
maybe
नहीं
little delay is there or
नहीं स्लाइड शो का मेरा मतलब आपकी स्लाइड्स दिख रही है, लेकिन साथ में वाले जो ये जो आउटलाइन फॉर्म है ना, उसमें भी नजर आ रहा है, तो इट शुड बी कंप्लीट स्लाइड शो ना, वो नहीं आ रहा है। मैं ये कह रहा
मैं लेट मी सी। वैसे तो मैंने तो इसको स्लाइड शो पे ही सेट
हूं।
किया
नीचे
है।
देखिए, नीचे देखिए,
हाँ जी,
नीचे देखिए सब, वहां से देखिए।
जस्ट अ मिनट, मैं दोबारा से शेयर करता हूँ एक बार,
दोबारा करिए प्लीज।
कई बार हैंग कर जाता है।
जी। हाँ जी
अभी भी
डॉक्टर
नहीं आ रहा है?
साहब, नाउ इट इज विजिबल।
हाँ, मे बी उस समय हैंग कर गया होगा।
जी, थैंक यू।
फाइन, नाउ शुड आई प्रोसीड?
या प्लीज गो अहेड।
So these things happens when we do it virtually. So learning objectives, once again, what is the importance of microbiology, why we want to study it, and how we can apply this knowledge practically. So first and foremost thing which comes into our mind is, what do you think is microbiology? I want the participants to please type their responses. What do they think is microbiology? I think most of the people think it is nothing but a blank glass slide, which is only plausible theoretically. You cannot see anything. Someone has typed study of microbes. That's more of a theoretical questions. What do you understand by microbiology is? And then other people think absolutely right. Mr. Rizvi has typed that it is, I think there's some problem again with this. It is something which you see under the microscope. Correct? And for others, hello, I think, hello, I am still connected or hello? Okay, आपकी आवाज 2 दफा आ रही है बस. I think there is some problem with the connection either at your end or at my end. I don't know. But there is some problem. Anyway, I'll continue.
So everything is fine. Actually,
okay, fine. I'll proceed. So, but as a clinician, as a periodontal surgeon, what we want to understand is, it's not simply study of microbes or just something which we see under the microscope. It has direct practical implications on our clinical practice, because we need to understand that microbiology is a varied life entity, and microbes exhibit definitive interactions, and they too have a lifestyle as we do. Everyone understand what is a lifestyle? What's a lifestyle? Please type your responses. I want the session to be slightly interactive so that we can understand whatever we are able to achieve in this 1 hour. At least कुछ तो हम लेकर के जाएं घर. Please type your responses. Only one person. आकांक्षा ने good morning किया. रिजवी साहब ने सिर्फ एक response दिया अभी तक. I want to see more of these responses. What do you understand by lifestyle? When I say lifestyle of microbes, what do you think I'm talking about? I'll give few seconds for you to type, then we'll proceed.
Time लग जाएगा.
Okay, someone has started at least. Miss Vishwas, I guess. Please be free to type. इसमें तो बहुत आसान काम है, टाइप ही करना है. You don't have to speak up even. Interaction with the host, that's fine, but that's too technical. I want it to be more simple. If I talk about your lifestyle, then in human terms, how will you define lifestyle? Because they are very similar to us. एक पहली चीज जो we need to understand is they are not different from us. These microbes, maybe viruses, bacteria, fungus, they all are similar to us. Think about yourself, then think about these microbes. Environment which the microbes want, yes, fine. The way you live, fine. Some more responses, then we'll elaborate it further. Go ahead, please. Yes. Shefali and Chetan, thank you for your responses. So, I think I need to say good morning once again. Boss, wake them up. आपकी सुनेंगे.
डॉक्टर साहब, बच्चे आप कंटिन्यू रखिए, यहाँ पे यही चलता है.
ओके, मुझे लग रहा है यहाँ लॉगिन करके भाग तो नहीं गए.
आगे कोई नहीं है.
अच्छा, fine. So at least we have few responses, and most of them are saying the way they live, the environment which the microbes want. Absolutely fine. So that means they are pretty similar. They have certain preferences and they have certain dislikings. So the first and foremost concept we want to clarify is that they are not static. They think, they evolve, they interact, they react, they do everything we do in our habitats, in our environments. So this concept is a major difference which came up in the last few years, the way we looked into the etiology of periodontal disease. Earlier, we used to think that it is the bacteria only who are responsible for periodontal disease. अगर बैक्टीरिया नहीं होगा बीमारी नहीं होगी, एंड अगर हम बैक्टीरिया को खत्म कर देंगे बीमारी खत्म हो जाएगी. That's now the concept is now obsolete day by day, and people have started to think that it's not only the bacteria, there are other organisms. That's why the terminology has changed. So the first and foremost thing I want you to understand is it's not only the bacteria, there are other microbes. That's why the term has changed to microbiology. Microbes, including what are the microbes? People, please type. What are the microbes they know about? Like viruses, bacteria, fungus, bacteriophages, spirochetes, all these have a role to play in periodontal diseases. So the baseline is that the periodontal disease are caused by many organisms, not just bacteria. Number one. Number two, these microbes might include different forms of microorganisms who have a lifestyle, who have a community which interacts in a lively fashion as we do as human beings. So anyone having any problem to this point, please type their questions. I'll be happy to answer that during the presentation. So having said that, that brings into our mind why microbiology in periodontal disease. So हम क्यों पढ़ना चाह रहे हैं microbiology? We are not microbiologists, but we are clinicians. Because the most common diseases are associated with microbes. Periodontal diseases happen not in isolation, but because there are certain etiological factors which cause the disease. And the most prominent factor are the microbes which initiate and progress the disease process. So it is very important for us to understand that the bacteria, the microbes are important to understand the etiology of periodontal diseases. The nature and characteristics of these bacteria determine how pathogenic they are. And once we know about their basic nature, we can, of course, try to regulate the way they behave, the way they interact, and the way they cause damage to our periodontal tissues. Correct? So, another message is that we must understand the nature of these microbes so that we can stop them. An analogy you can draw is if you want to stop someone from entering your classroom right now, you want to know where is the door, who is the person who is going to come, whether he is Dr. Vivek Bains or some junior. So once you understand the characteristic of that person, only then you can ask them to stop or not to stop. If you just do it blindly, you might turn up an uneventful scenario, which you don't want to. You might land up yourself in trouble. So you want to be very clear whom you want to stop, whom you want to encourage. So that's what we want to do once we want to study the microbiology in periodontal disease. So at birth, what happens is once the newborn is there in this world, the oral cavity is almost sterile. And slowly as the baby starts to feed and is exposed to external environment, there is bacterial, microbial, and viral growth inside the oral cavity. There are few names which are mentioned in this slide. I don't want to repeat those names. You can go through them in the books. But what I want to clarify is that it's not that the baby is born with these microbes at birth. It's just that the oral system, the oral cavity is an open environment, and there are many areas which are exposed to the external environment. So these, as Dr. Shefali said, environmental factors help the bacteria to come and start living. Suppose we want to stay somewhere in a land where there is nothing. What we need to survive as a human being? The first human beings needed food, shelter, and space, and oxygen, air to breathe, fresh water. So these bacteria, viruses, microbes, they also need certain substrate, certain matrices, certain spaces where they can come, safely stay, have nicely their interactions with other people. They need a society like us. They need food, they need shelter, they need oxygen. Some of them need some other things. And in the oral cavity, there are plenty of spaces where they can come and stay, because they are narrow spaces, rough surfaces in the form of restorations, the saliva, which is a very good source of nutrition. And of course, there are external influences like food, beverages, sugar intakes, many things. So we have plenty to look into. It's like you go to America, you see many green pastures. For our oral cavity is like America for them. They will come and see there are many opportunities for them to survive and thrive. That is the reason they prefer these surfaces. So once you know that these microbes come and start replicating in the oral cavity, you want to know where do they stay, why do they stay? You know why do they stay? Because they need something to eat, something to drink, someone to talk to, and interactions. But do they stay freely, or they have certain security around them? So I have a question. Can someone enumerate differences between a colonized way of living and living in a scattered manner, as in Jhuggi Jhompris? Which lifestyle is better, living in a gated colony or in a haphazard Dharavi kind of a system? I think this is not a very tough question. No one wants to type, I guess. Okay. Okay, no problem. So we'll continue then. So the bacteria want to secure an environment where they can live freely, but yet get security from external threats. So the concept of biofilm was developed to make this thing more understandable, because the term plaque, which we normally use, is nothing but a type of biofilm. And the difference between a biofilm and plaque is that biofilm is considered to be a dynamic structure in contrast to plaque, which is of course a type of biofilm, but the focus is not on the dynamic nature of the plaque. When you think about plaque, people think it's just a deposit somewhere, maybe in the heart walls, maybe on the joints, maybe on the teeth. But actually, it's a biofilm, and bio means living, and film is the thin layer. So, living character, the life character of the plaque gives a better term, a biofilm. So, there is a difference between dental plaque and biofilm, that biofilm is a dynamic structure. There are different types of microbes living inside a biofilm, like colony, while a plaque is supposedly another term which doesn't describe the whole nature of the biofilm. Then there are terms like material, food debris, and calculus, which are, of course, the less organized structures. These structures are, of course, containing microbes, but they are mostly in a free planktonic states and can be easily removed by mechanical plaque therapy. They are not that secure as biofilm is. And what we want to concentrate upon is what is a biofilm, how it is formed, what is the nature of biofilm. So you should erase all those concepts which you were having previously in your mind, that only bacteria are responsible for causing the periodontal diseases and they can be easily killed. It's not like that. They are not living in isolation. They are not living in plants. They are living in a secure, safe structure, interacting with other microbes, living in interaction with them. And that structure is called biofilm, which is an ever-changing structure. That's why we call it dynamic and powerful structure. So when I'm stressing upon interactions within the biofilm, there's a term called co-aggregation. As I told you, they live together. Co-aggregation. They are living together. They are cooperating with each other. They're helping each other sometimes. Sometimes they fight with each other, just like we do in our colonies. One neighbor is good, you be happy with him, share mithai with that neighbor. The other neighbor is not happy, you want that neighbor to leave. But these interactions do happen in every living structure. And that too happens in a structure called biofilm. Here, the organisms are viruses, bacteria, again, fungus, spirochetes, I told you. So these interact with each other and live together. And most of these interactions are in the form of bacterial interactions, where they stay together, help each other grow. These interactions are called co-aggregations. And when you see these co-aggregations under the microscope, sometimes they appear as bridges, sometimes they appear as test tube brush, and sometimes like corn cob. Corn cob is bhutta, chali, makki. So these cocci forms and these rod forms stay together. They form corn cob like appearance, and these you can say bristles like filamentous bacteria and again rods. So test tube brush kind of appearances. So these interactions are very important because if you know the interactions between the bacteria, if you, for example, know that Chetan and Rizvi are friends and they are doing good, you let them stay together. But if you think Chetan and Shefali are not interacting properly and they might create indiscipline in the class, you want to separate them, make them sit on different benches. So the same principles we apply here on microbes, that we know that if interactions, the co-aggregating bacteria are good for us, we let them stay, we don't bother. But there are interactions in which bacteria propagate each other's growth and they are harmful to us and we want them to stop. So our focus then, once we know which bacteria interact with which bacteria, we can at least, and we know, say, the antibiotics against one bacteria, then we can indirectly stop the growth of the other bacteria who is dependent upon the first one. So the interactions are very important once you start to analyze the nature of biofilm. Based upon these interactions and the nature of bacteria, viruses involved, many of people like us try to zero in on the organisms which cause disease and how they can be stopped. So many hypotheses were given. Some said that we can just straight away remove all the biofilm and so all the bacteria who were present inside the biofilm or plaque will be destroyed, and hence the disease process will stop. Others said no, there are only specific kind of harmful organisms which we need to stop. Rest are good. Why do we want to kill those people who are not harming us? Why do we want to disturb the growth of those microbes which are useful to us maybe? So they said there is a specific type of bacteria which are responsible for specific diseases. That was called specific plaque hypothesis. And as in the initial lecture, during these lectures, someone said environment and ecology, they do have a role to play. Of course, someone said we don't need to even touch the bacteria, because if we change the environment, the viruses, bacteria, the people, the microbes living inside the biofilm, they will automatically change. They might die, they might survive, but they will change and they will shift from less harmful to more harmful, or from more harmful to less harmful forms, depending upon the environment which gave them. So the non-specific plaque hypothesis is the one which we are still relying upon. We remove all the plaque, we try to remove everything, we give spectrum antibiotics. All that thing is based upon non-specific plaque hypothesis. We don't know against which bacteria we are giving the antibiotic. We are just presuming that we are giving a broad spectrum antibiotic which might act against pathogenic forms of bacteria responsible for periodontal diseases. While the focus is now being, as our knowledge on microbiology is increasing, the focus is now being shifted towards specific plaque hypothesis, which says, again, I am repeating, which says that there are only specific bacteria which need to be dealt with. There are only specific viruses which need to be killed. While the environmental or ecological plaque hypothesis says, no, we should focus our attention on the environment in which they live, because if we change the environment, there is no possibility that the viruses or bacteria will come in that environment. Once they don't come, there's no need to kill them. So there's another theory called keystone hypothesis. So keystone says we focus on only the most culprit ones. If they are present, there's no point in changing the environment. There's no point in giving antibiotics. So we should focus on the most culprit ones who are the leaders of those, you can say, gangs which are causing troubles. So there are few hypotheses. These are hypotheses because none of them has been proven till date to be absolutely correct. They relate to periodontal diseases, but they are not very accurate. They are not so clear that we can say, yes, we go by non-specific or we go by keystone hypothesis. You need to include all these concepts into your mind once you are treating your patients. So sometimes you need to work upon your non-specific, for example, in a non-surgical mechanical therapy, sometimes specific, where you give specific antibiotics. If you know that there is a possibility of, say, anaerobes, say, for example, in periodontal abscesses, and sometimes you change ecological plaque hypothesis. You just change the dietary habits, for example, in caries. You change the dietary habits in case of, say, pregnancy, during pregnancy. And then there are keystone hypotheses, which are still in budding stages, where we want to be absolutely sure which are the bacteria or viruses which we want to kill. I hope I'm able to make you understand at least few concepts, because I'm not getting any responses from the audiences. So in summary, you can say, so biofilm, as I said, is a closed kind of secure structure, but it's an interactive one, composing of a matrix and like any other structure, organic and inorganic components. But the main factor which distinguishes this biofilm from the rest of the structures is that it's a living entity. The main thing is that the organism living within the biofilm, they are different than the organisms which are in a free planktonic states. So as you can see in this figure, that this outline in the mushroom shape is the biofilm, and you can see the fimbrial-like structures. They are attached to the underlying surfaces from where the growth begins, and they continue to grow like a mushroom, and as it gets old, the size of the mushroom increases. So again, you can see on this slide that biofilm is a very significant structure, right? Because it is a habitat for growth, containing many factors like oxygen, nutritional supply, and it's having a metabolic diversity. And the microbes, as repeatedly said, living in the biofilm are more secure because they have security against antibiotics and external responses. So once they are more secure, of course, their ability to cause disease is enhanced. These are the few take-home messages which you can at least try to remember. So once you know that biofilm, at least at this point, I'm very sure that everyone knows that biofilm is not a good structure in terms of periodontal health and disease process. Is it? Is it a good structure or a bad structure? No. So biofilm is a very, very, very harmful structure in terms of, yeah, someone typed bad, absolutely bad. So once you are sure that it's a bad structure, you want to, if you're sure that someone is creating trouble in your colony, for example, there's a from where you're having obnoxious odors, बहुत दुर्गंध आ रही है जहां से आपको, you want to, what do you want to do? You want to close that pit, you want to maybe clean it, or you want to altogether shift it towards somewhere else outside your colony. So that's what you want to do with the biofilm. But before you do that, you must know where is the leakage, why the smell is coming, what is the reason behind that blockade. And the same thing we want to apply here. When we want to destroy the biofilm, we must know the nature of biofilm. What is the need to, why there is a need to know the nature of biofilm? Because if you don't know the nature of biofilm, what it is composed of, how it is behaving, what are the factors which are propagating its growth, and what are the factors which might result in damaging of biofilm, you cannot help your patient. You cannot help your treatment as well. So in order to know how it is being formed, we must know how it all starts. We again go back to the initial stage when at birth there is nothing inside the oral cavity, no bacteria, no virus, after everything sterile. Then how this process starts? Why? There are 3 points where we can intervene. So the first point of intervention is we just start at the point where it starts forming. We just inhibit the beginning of formation of biofilm. Before it becomes a biofilm, it starts as pellicle. So there are steps in which a biofilm is formed. So we can intervene in each and every step in order to control the damage it causes. Am I clear? Yeah. So pellicle formation. The term pellicle, the pellicle is the first step in biofilm formation. It's nothing but, you can say, a thin layer composed of glycoproteins, some water, and it's a thick, thin, slimy layer having free planktonic bacteria. The शुरुआती bacteria, viruses, जो भी आते हैं, they come and start staying on a rough surface wherever they find a place. Again, I'll quote an example. Once you say visit, you want to go to US, you stay there for some time, you take a course in Australia or US or Europe, and initially what you want to do is you just want to get used to the environment and take a course because you want to know how can we get a permanent citizenship there. So before they become permanent citizens of our oral cavity, they just come and start staying wherever they find a place. If they take a menial job, they start working in a petrol pump like we do. They start just surviving. They don't thrive, they just survive. They come, start staying. And that layer in which they stay is called pellicle. So once they come and they stay there for a while, they come to know the environment, they get used to the adjacent surfaces, they start spreading their wings, they interact with other microbes, and they make a change in the environment. And slowly and steadily, they become more adhere to the underlying surface. Their attachment, their affinity for the underlying surface within the oral cavity structures increases. So from when we move from pellicle to the initial adhesion stage, it is getting difficult for us to remove the biofilm. The biofilm is getting stronger and stronger as it progresses from pellicle to initial adhesion. And then at a later stage, they even get attached to the underlying surface. That means they do not want to leave the country. Even if you force them out, they tear down their passport and they want to stay back because they now are accustomed to the good environment, the good nutrition, everything they are having in a luxurious fashion. So when we move from pellicle to initial adhesion, you can clearly see pellicle is a delicate structure. You can easily throw them out. Initial adhesion slightly higher level where you need to put some effort to kill them or remove them. And then if you still don't intervene, if you still don't understand the gravity of the situation, then there's an attachment. And once they attach, it's become cumbersome process. The same process which we want to be easy becomes very difficult. And slowly, once they attach, they start to mature. For example, I give you another example. You join your course in MDS, say you want to take orthodontics, you get periodontics. But as you spend time in the department with Dr. Vivek and other learned teachers of yours, you start to develop interest in periodontology. You get in second year, then someone says, okay, you get a orthodontics in KGMC maybe. Then you think, okay, but I have already spent a year in perio. But if someone forces you, okay, you please take that seat now. I am leaving. Let's exchange it. You might leave. But then you are in the third year and the offer comes, you say, no, I have already spent 3 years, spent a lot of time. I have developed interest in periodontology. I'm not going to leave. So as it's a universal fact, the more time you spend anywhere, you get attached to that thing. Maybe it a person, a place, or a thing. So the same rule applies to these microbes. So pellicle formation to initial adhesion, attachment, and then plaque or biofilm maturation. So the characteristic changes which happen during this maturation is because again you go back to your initial stages. When you go, say, in a new place where no one is inhabiting, you have plenty of resources. So initial stages during pellicle formation, you have plenty of resources. That's why we run to America or Europe or say greener pastures from villages to towns because you have plenty of resources. Dhire, what happens is everyone starts. The one person who went first to USA, he says, okay, Lucknow is very good. Come from the village Lakhimpur se aa jao Lucknow. ये लखनऊ में ज्यादा opportunities हैं. So facultative forms, they interact with the initial colonizers. They have a sharing capacity, they can share. So the initial colonizers start sharing those resources with the facultative forms. I'm not going to the details of the names of the bacteria or viruses involved. You can go through them in books. I just want to clear the concept. What happens? Why happens? Why there is plenty, why the initial colonizers have affinity for oxygen? Because they have plenty of oxygen. They have plenty of carbs. So there is plenty of affinity. They cannot survive without oxygen. So they are pure aerobes, strict aerobes. They survive on carbs, not on proteins or the breakdown products. Then comes the next stage where the initial colonizers are followed by facultative forms who can, of course, who need oxygen, but they can thrive on without oxygen also sometimes because they think, okay, fine, we have come second, we can adjust. After a while, when the initial and secondary colonizers, facultative forms come, there is again a pressure on the limited amount of resources. So that what's happening is the resources are limited, the population is increasing. And as the population is increasing, the competition, of course, increases. Everyone who's living in India knows this thing very well. So we are able to understand this thing better than Europeans or Americans because we daily face this thing. So जहाँ पे सड़क अच्छी होती है, ट्रैफिक अपने आप अच्छा हो जाता है, and then you start fighting after a while. Initially, it's an open way, and then there is congestion. So once the congestion starts up, then there come the most drastic forms of people, the goons of periodontal microbes, microbiology, that is secondary colonizers. They just want to come and barge into other people's spaces. They just want to come and take everything which is there. Loot machana chahte hain. They come, they start colonizing, and they are hard, thick-skinned kind of microbes. They can survive in any damn tough conditions because they have come through a very tough competition. They have no other way to survive but to kill others, damage others. They hide, they run. They thrive on anything they get, and anything which is there means actually they can survive on proteins, breakdown products of carbs, amino acids, and they even can survive without oxygen. They are strict anaerobes, and once they don't eat, even if they don't have a space for staying, they enter your tissues. They are tissue invasive forms. That's why we call P. gingivalis or Tenonella forsythia. They are very pathogenic forms of bacteria because they can thrive, they can survive within the tissues even. They start eating your tissues, unlike initial colonizers who can be easily managed. And then facultative, they can of course be managed, slightly tougher than initial colonizers, but the secondary colonizers are the ones who are primarily responsible for causing the disease process and progression of disease process. They release toxins which are tissue damaging, they are tissue invasive, they are strict anaerobes. So the clear-cut demarcation in the plaque growth and maturation is, once again I am repeating, that the plaque becomes from strict aerobe, the biofilm nature changes from a strict aerobic environment to a strict anaerobic structure, having tissue invasive form of bacteria and more pathogenic forms of bacteria. And when these things happen, when these things happen, the final stage in plaque maturation is क्या होता है जब सब कुछ आपने खा लिया पी लिया, then you go for nirvana, liberation. Actually, liberation. This is a scientific term. I'm not using it on my own. This is a scientific term used to describe the last stage in plaque maturation. That's liberation. What happens is that mushroom continues to grow, and grow. And once it reaches the zenith of its maturation, macrophages within the biofilm, they break down the structure in the form of bubbles. These bubbles are called liberated forms of microbes, and they start inhabiting the other sites available. So this way, the plaque continues to propagate. Correct? So I think at this point of time, we are at least clear that plaque is not a good structure. Biofilm is not a good structure. Plaque and biofilm are two different structures. Biofilm, hello. Biofilm is a dynamic structure having composition of various types of microbes, and they interact. And there are two things which I want to clarify is that whenever you treat your patients, you must think that there are certain microbes involved which are causing this disease process. So rather than going blindly, you must understand a few things which I want you to take home.
Mobile se joined.
So periodontal disease, I'm just reiterating time and again so that you remember a few things. So periodontal disease is a polymicrobial disease. I think it's pretty clear by this time now. Importance of periodontal microbiology is to know the basic characteristics of periodontal microbes and for designing prevention and management strategies. How can we design prevention and management strategies? Because we know at which stage and at what stage what is happening. So at that level, if you want to say prevent even the beginning, you can ask your patient to brush regularly, because when you do mechanical plaque control, it's very easy to remove pellicle compared to a full mature biofilm. Similarly, if there is biofilm formation which is mature, researchers have found that you can give them antibiotics which damage the structure of the biofilm. You can give nanoparticles which damage the structure of biofilm and change the environment within the biofilm, hence making the microbes living in the biofilm more prone to your treatment plans. They can be killed. So one such therapy is called chronic suppressive antibiotic therapy. This is a recent one. Just this is the only thing which I have included because this seems quite interesting. So chronic suppressive antibiotic therapy is in which you persistently give antibiotic to the patient having chronic infections. These have been used in lung diseases, in valvular plaques to destroy those plaques which are formed on cardiac walls, and in orthopedics also, where you have seen biofilms on prosthesis, on artificial joints. All these areas have been tested while giving this chronic suppressive antibiotic therapy. What they do is they put the patient on a persistent dose of antibiotic, and mostly azithromycin has been found to be quite effective, and they alter the structure of biofilm and suppress the growth of microbes within the biofilm. But there are side effects associated with this evolving therapy which needs to be explored further. So people have started to actually use this knowledge practically. We are also using it when we are doing non-surgical periodontal therapy. So it's very important to understand the dynamics of biofilm, and you should not underestimate it. You should not look at it as just as a theoretical topic where you want to cram the name of the bacteria. You want to know how these bacteria are working in that environment. And you always think of bacteria, viruses, bacteriophages, and compare them with human beings. Their nature, their way of acting is almost similar to the way we interact. They also want nutrition. They also want people around them. They also want a secure environment. So I think the time is running out. I just want to emphasize that you must understand the dynamic nature of biofilm so that you can apply it practically in your clinical practice. Although the topic is quite vast, we can go into the details of how these treatment regimens are being applied, what are the different modes of treatment regimens which are being utilized to treat these bacteria, kill these bacteria or viruses, but that takes time. So we might get another opportunity, maybe in another lecture or so, we can discuss those things. For now, I think it's enough. And I thank you once again for a very patient listening. And it's been a little too patient. I would have loved if someone would have been more patient. Thank you very much, Dr. Vivek.
Thank you, doctor.
And good morning once again. I think I made everyone slept.
No, doctor. Everyone was not slept, but definitely people were not interactive too much as you were expecting from us. So another point I would like to say, I'm sorry for the audience because due to some technical difficulty, there is change of password. That's why many participants, many faculty members could not join. So Dr. Ajay, it
Okay,
happened in the country during the lecture. The password has been changed, तो थोड़ा सा गड़बड़ हुआ है इसकी वजह से. So
कोई बात नहीं, it's fine.
जी जी. Dr. Chetan, over to you.
अभी तो initial colonization थी, next time maybe will be better.
Yeah, I'm there.
Dr. Chetan, over to you.
Thank you, Dr. Ajay. This is Dr. Chetan. I'm a professor in Department of Periodontology, Saraswati
Right.
Dental College. And
Right.
your lecture has been very simple, very interactive. And I would say if definitely we would have had a very large audience, they would have loved it. But
Thank you so
anyways,
much.
it's on record. We have the recording of the lecture. And the way you present is, it makes life simple. So
Thank you so
anyways,
much.
thank you so much. I would like the organizing team to present the certificate of appreciation to Dr. Ajay. Can we share that certificate, please?
Thank you
That
very
is a
much.
small token of regard.
Thank you.
That is a
Thank
small
you.
token of regard from our department, our college. And we would love to have you for further lectures also. And we hope that we'll give you a bigger podium than this. So nice of you.
Thank you so
Thank
much.
you, Dr.
Thank you
Ajay.
very, very much. Thank you. It's been so kind of you guys to
thank you.
invite me. And if any errors or any lapse was there on my part, I sincerely apologize for that. I would like to improve.
Dr. Ajay, you are a part of the Perio family. So
Yeah.
it is our job to invite you. You are a part of the Perio family.
Thank you so much.
Thank you, Dr. Ajay.
Thank you. Have a great day ahead. Thank you.
Same there. Same. Bye-bye.
Bye.